At UAMS, in our doctoral internship program, we have a child and adolescent track. And really, those training experiences prepare you to provide evidence-based treatment and assessment services for childhood traumatic stress. The main site for you on the child track when you do clinical work is the UAMS Child Study Center, which is an outpatient clinic that serves children birth through 17 years of age. We are really proud of the fact that we center our clinical work in cultural humility, and because we're the only academic medical center in the state, we tend to see a higher acuity of families, and a really large percentage of the children and families that we work with come from historically excluded or under-resourced families. And you also get to do clinical work in both inpatient and outpatient settings, hopefully preparing you for the job you want to have later and the experiences that matter to you. One of the evidence-based childhood treatment models that we do here for traumatic stress is called trauma-focused cognitive behavioral therapy, or TFCBT for short. It's an evidence-based treatment that serves kids 3 through the age of 17 and really focuses on helping children not only with their traumatic stress symptoms, but can also be very helpful for them in behavioral difficulties or other emotional symptoms like depression. One of the unique things I think about our clinic in general, and this is certainly true for TFCBT, is we have a really strong partnership with our child welfare system, which means a lot of the kids and families that you will have the opportunity to serve are in foster care or pre-adoptive care, and you get the chance to collaborate not only with the caregivers in the room, but also with folks like caseworkers, attorneys, CASA workers. Additionally, on this site, you will be able to potentially see young children, so preschool and school-age children with problematic sexual behavior, depending on the clinic capacity and referrals that we get at that point.
The thing I really love about TFCBT is that there is encouragement for strong caregiver involvement. And so what that means is within the model, we are helping caregivers and parents assume the rightful place as their child's guide to recovery. And I think that's so important because we're putting them in the role of the person that that kiddo will turn to in times of pain.
PCIT stands for Parent-Child Interaction Therapy. It's a therapy that's been designed for kids between the ages of 2 and 7 for ones that have behavior problems. PCIT is really helpful for improving child behavior, but also helping parents feel less stressed and overwhelmed, and also helping them feel more confident with their parenting skills and abilities.
One of the really unique aspects of our PCIT rotation is that we can really provide strong training that's matched to your previous experiences with the model. So if you're coming in never having done PCIT, that's totally fine. You'll probably observe a case or two with your supervisor and then quickly get into the opportunity where you'll be leading sessions, but with your supervisor right next to you in a co-therapy model. That way you can feel really confident in building up your independent coaching skills while knowing your supervisor is right there to help you out in case you need something. If you come into the PCIT rotation with previous PCIT experience, particularly if you've already met criteria for certification as a therapist, we're also able to provide you with level 1 within agency training here at our site, which means that during your internship year, you could make significant progress, if not complete, requirements to be a level 1 trainer by the time you leave here.
Child-Parent Psychotherapy, or CPP for short, is a therapy for children birth through age 5 who have experienced really scary, dangerous, or violent things such as child abuse, so physical abuse or sexual abuse, or car accidents, or even experiencing things like being in a fire or a tornado.
So this might be one of the first opportunities you have to do clinical work with infants and toddlers in addition to preschoolers. CPP also draws a lot of referrals from our county's Safe Baby Court team. This is a national child welfare model that focuses on providing a trauma-informed experience for young children in the foster care system. Because our referrals come from our county's SBCT, we tend to do a lot of collaboration on this rotation with attorneys, CASA workers, child welfare workers, and you may have the opportunity to testify in court as well. Also within this rotation that is unique is it is an evidence-based treatment model, but not a cognitive behavioral model. And so for many of our interns, this is also a chance to learn something that is evidence-based, but has a different theoretical orientation than what they might have been exposed to.
Interns have the opportunity to co-lead a multifamily dialectical behavior therapy, or DBT, skills group for teens and their caregivers here at the Child Study Center. DBT is an evidence-based treatment that is designed to address emotional and behavioral dysregulation broadly. We know DBT is a transdiagnostic approach, really being appropriate in helping with a wide variety of mental health conditions. Teens and caregivers that are referred to DBT often have complex psychiatric presentations. As part of the DBT rotation, interns will have multiple opportunities to lead mindfulness exercises, facilitate homework review, and teach new content across the modules throughout the training year. Really, the hope for interns participating in this rotation is that they build a solid foundation of knowledge and skills in DBT that would help prepare them for pursuing DBT Linehan board certification later in their career.
The Child Diagnostic Unit, or CDU, is a psychiatric inpatient unit that provides services for children ages 3 to 12 who are in need of diagnostic clarification due to the complexity, frequency, severity, and intensity of their symptoms. The mission of the CDU is to provide child and family-centered care in a collaborative, compassionate, and trauma-sensitive manner to clarify diagnoses and help establish treatment planning for the child. The CDU has 10 beds, and all children have a 28-day stay with a planned admission and discharge date. And we use an interdisciplinary approach. We rely on specialists in child psychiatry, psychology, social work, occupational therapy, speech and language therapy, education, and nursing. The milieu model we use on the unit is collaborative problem solving, or CPS, which is based on the premise, kids do well if they can. Interns conduct comprehensive psychological evaluations. This includes administering tests of intelligence, academic achievement, adaptive functioning, mood and behavior, and autism spectrum disorder symptoms. Interns also engage in behavioral observations, clinical record review, report writing, and attend multidisciplinary team meetings.
Interns participate in an outpatient psychological evaluation rotation here at the Child Study Center, serving both children and adolescents. Really, the goal for these evaluations is to clarify diagnoses and assess level of functioning for the purpose of treatment planning. Referral questions include diagnostic clarity related to intellectual disabilities, learning disorders, ADHD, traumatic stress, mood concerns, autism spectrum disorder, and kind of broadly disruptive behavior. Interns will gain experience in clinical interviewing, administering and scoring and interpreting psychological measures, diagnostic conceptualization, and providing recommendations for treatment, and also reviewing findings during feedback with families. Another training opportunity embedded within the psychological testing rotation is the opportunity for interns to conduct complex trauma assessments. The Complex Trauma Assessment Program is a joint partnership between UAMS and the Arkansas Department of Human Services. And the goal of these evaluations is to conduct a trauma-informed evaluation for children ages 3 through 18 who are in foster care. As part of this rotation, interns often collaborate with foster parents, caseworkers, attorney ad litems, court-appointed special advocates, and possibly residential treatment center personnel. And really, the goal for these evaluations is to provide evidence-based diagnostic conceptualization and evidence-based recommendations related to the level of care and service that these children need in order for them to grow and develop and thrive.
Our interns, in addition to their clinical work, also have the opportunity to participate in an optional research rotation. This is 6 months of block time in which we really encourage our interns to take advantage of the fact that we are an academic medical center and grow their scholarly skills in addition to their clinical ones. There are lots of different opportunities for research here at UAMS under the mentorship of a psychologist that range from things like writing a manuscript, co-facilitating or co-presenting with trainers in evidence-based trauma treatment trainings for community members, or at things like conferences or for stakeholder groups in our state. You can also do research associated with other types of work in our clinic, for example, brain imaging projects that look at parent-child interactions to determine how do we really impact families the best that we can.
We mean it when we say we're training centered. And so hopefully what you'll find when you come here on internship is that you're able to customize a lot of experiences depending on what's important to you. What are areas of development you want to have? What are strengths you already have that you really want to grow because they're important to your future career? I think what you'll find here between that customization as well as the high kind of emphasis we put on supervision here at UAMS, that it feels like a really training-centered environment.
So our hope on our research rotation is for interns to leave our program with at least one tangible product, whether that be a presentation, whether that be a manuscript, and really focuses on figuring out what do you need in the next step of your research training. We try to be as flexible as we can so that way the opportunity you're getting is building up the CV that you need to have.